Welcome back. 5 years ago, the four nations of the UK came to a standstill. We were placed into lockdown, told to stay at home and only leave for essential purposes. Let's remind ourselves.
From this evening, I must give the British people a very simple instruction. You must stay at home.
It's the UK waking up under lockdown today with all gatherings except funerals banned and all non-essential shops told to close.
Normal life to lockdown in just 7 short days. The pace of change matched only by the acceleration of this disease.
Shutdowns like this one and a clear instruction to stay at home.
And while not everyone is heeding the request to stay at home, you can feel the life being squeezed out of the street and the city.
Well, joining us to discuss that 5-year anniversary is political commentator with Young Voices UK, Luca Watson, and Professor of Operational Research at University College London, Christina Pagel. She was a member of the independent SAGE, which provided updates on the national and international COVID-19 situation. Very good morning to you both. Thanks for joining us. Luca, watching that clip back, does it sort of send a shiver down your spine? What was lockdown like for you and people your age?
Yeah, not quite a shiver at this point. I think it's been so long that we've been able to get over it now. But it was really tough, as I think it was for everyone, but especially for young people, many of us, deeply interrupted our education and also the milestones in life that everyone tells you to be excited about when you grow up, you become an adult, university, that sort of stuff. It was gone. And there was a recognition at the time as well that we're never getting that back. Once it's gone, that's it forever.
And Christina, for you being part of SAGE, that independent body that was advising the government, I remember breastfeeding Lucia at the time, absolutely locked into Sky for those press conferences every day. It was like a lifeline for people. What was it like for you being part of it?
Yeah, so just to be clear, I wasn't on the government's advisory body. It was the independent SAGE group, which was more public-facing and communicating to the public. But those first 18 months of the pandemic, I've never worked harder and just felt that constant anxiety every day.
Why was that?
Why? Because we're in the middle of a pandemic, because I work in healthcare and a lot of my colleagues and friends work in intensive care, and just hearing about what it was like, I was worried for their health, for their lives. I was worried about my parents. I was worried about saying the wrong thing or doing the wrong thing. You didn't know what was going to happen. It just felt like such a momentous thing, like nothing was going to be the same again. That's how it felt.
Professor, if we snapshot, today with all that we've learned, with the costs of lockdown that we know, hindsight, of course, that we did not have then, do you think the extent and I guess both the severity and how long they lasted of the restrictions that were imposed were the wrong decision or not?
I mean, the first lockdown 5 years ago, we didn't have any treatments, we didn't have a vaccination, no one was immune, we didn't have testing, we didn't have tracing, we had really nothing else to do. Now that is an issue, and the inquiry looked at that. But it was kind of, a lockdown is a terrible choice, but so is an unchecked, deadly pandemic, right? So we had two awful choices, and I think then we had no choice. I think we could have prevented the next two lockdowns, and they shouldn't have happened.
Luca, what's your view on that? Do you think that too much focus was purely on stopping the spread and not perhaps on quality of life as well?
Yeah, I think it was underappreciated just how difficult lockdown was for some people, and especially for my generation, for whom the virus, for the most part, didn't pose a deadly threat. There were some exceptions, but broadly this was a virus that affected older people, not younger people, and nonetheless we were forced to sacrifice ourselves, to lock ourselves up, to protect the spread for mostly older people. And the thing is, even today, we're still now saddled with the burden because, of course, there was immense debt, fiscal debt, that came from the lockdown, and it's our generation who are expected to pay that off in the coming decades. And so it's sort of a double whammy. Not only did we miss out at the time, but still today, now we're paying the cost of lockdowns.
And then that's interesting, is it, what Luca says, Christina, about the impact, and we're just learning about the impacts, particularly on people just starting out in education. Lectures were on Zoom, but also the early years and the impact that we're seeing in sort of reception upwards in schools.
I mean, I'm not going to sit here and say that lockdown doesn't have terrible impact. it does. But the way to prevent a lockdown is to prevent the spread of an infectious disease, right? It wasn't a choice between lockdown and normal life. It was a choice between lockdown or tens of thousands more people dying. And in that first year before vaccination, about 20% of people ended up with long COVID, which includes younger people. And so the impact of that on our economy would have been devastating.
Going back to what you said, though, about maybe the first lockdown came in a moment when we didn't know that much about the disease, and perhaps more importantly, the nation wasn't as educated about its dangers. So there wasn't a sort of middle ground option, which perhaps was available for the second and the third lockdowns. Might that be available if there was another pandemic? Would the nation understand that you could have some rules, but also freedom at the same time? Or do you see it, if it emerges again tomorrow, as a binary choice in the short term between lockdown and not?
It's not about a binary choice. It's how do you have systems in place that you can stop it spreading, right? So you need to make sure that each person who's infected doesn't infect more than one other person, maximum. And you can do that if you have really good testing in place, really good contact tracing, and really good support for isolation, depending on the disease, but not every disease that would work for. So it really does depend on what kind of pandemic we see next. But the key thing is to get there really early. And we started late. It had already been established in the country by the time we got to lockdown 5 years ago. And we just weren't out of options.
Yeah, I mean, if you look at the charts of excess deaths and economic performance, not that they're the only two metrics, we score both badly on both, which is rare, sadly. Luca, just to round it all off, I mean, it's clear what, understandably, your view is and how this affected you. That said, do you have some sympathy for the politicians who were sort of put in a pretty impossible situation? Even if they could have done better, it would have been very hard to exactly nail the situation.
Not really. I mean, this is their job. When you stand for office, you understand that your job as a politician, as a leader, is to lead in difficult circumstances. You accept that there might be a war, there might be a pandemic, you don't know, but you think you're up for the job. So I don't feel sympathy necessarily. But look, I don't think it's sensible at this point to constantly relitigate lockdowns and so on. It's done now, it's over. I think we need to look forward, and some things we need to look at, for example, as I said, the debt from lockdown. Where should that burden disproportionately fall? Should it be on young working people who, as I said, sacrifice themselves or forced to sacrifice themselves mostly for the more elderly? Or should that burden be spread out more evenly across society, including, for example, maybe pensioners who could maybe take a cut to help out relieve that burden?
Really interesting debate. Great to have you both. Luca, Christina, thanks so much.